is your pharmacist Sidra. Today I'm going to talk about the recent approval of the additional dose of COVID vaccine. COVID pandemic is over for sure, thank God, but COVID is still around, and ones at most risk are elderly and immunocompromised people. So CDC has approved the administration of an additional dose of the COVID vaccine for those aged 65 years and older and those who are moderately or severely immunocompromised. So that means if you are immunocompromised and 65 years and older and have received one dose of any updated COVID vaccine, be it Pfizer or Moderna, and it has been at least 4 months since that updated dose, then you should receive one additional dose. Now, let's talk about who is considered immunocompromised. Any individual who has a weakened immune system, which means their body is not able to mount a robust response to infections, will be your immunocompromised. This can be due to various factors, like patients who have undergone organ transplant are typically on high dose of immunosuppressive medications, and what these medications do is they suppress their immune system and prevent their bodies from rejecting the new organ. Of course, these medications are immunosuppressive and they tend to make these patients more vulnerable to the infections. Now, certain cancer treatments such as chemotherapies and radiation therapies can also weaken the immune system. Individuals with autoimmune diseases such as lupus, rheumatoid arthritis, or multiple sclerosis are also on immunosuppressive therapy because in these conditions, their immune system basically attacks their own body's tissues. So, of course, these patients should get the COVID vaccine dose. Also, certain chronic diseases such as diabetes, chronic kidney disease, and chronic lung disease can weaken the immune system and increase the susceptibility to the infection. Now, these are some of the common immunocompromised conditions. If you're not sure whether your health condition falls into this category, or you're just not sure about whether you're immunocompromised or not, just ask your pharmacist or provider to make sure that you qualify for the additional dose or not. One thing that I want to mention here, especially for our immunizing pharmacists or healthcare providers, that per CDC, you can self-attest to your moderately or severely immunocompromised status, and you can definitely receive that additional dose of COVID-19 vaccine wherever vaccines are offered. Now, vaccinators should not deny COVID-19 vaccine to any individual due to lack of their documentation. Now, why is this extra dose so important? Well, studies have shown that certain groups, particularly the immunocompromised and elderly, may not achieve adequate protection against COVID-19 after their standard vaccine series. So by offering an extra dose, we can help boost their immune response and we can restore their protection that has decreased since the previous vaccination. Also, by getting this additional dose, you can get greater protection against severe illness, hospitalization, and even death because of the COVID. One of the common questions I get is how soon you can get the vaccine if you recently had COVID. Well, if you recently had COVID, your body has naturally built antibodies against the virus. So you may consider delaying your vaccine by 3 months, but it would be best if you still get the vaccine, because getting vaccine after you recover from COVID provides that extra or added protection. Reinfection is less likely for a couple of weeks to up to a couple of months. So you can delay the vaccine for up to 3 months, but I would recommend you rather get it sooner than later. But again, to answer your question, you can wait up to 3 months to get the vaccine if you have recently had COVID. Another thing is administration of COVID-19 vaccine should not be delayed in patients taking immunosuppressive therapies. Whenever possible, COVID-19 vaccine should be administered at least 2 weeks before initiation of resumption of immunosuppressive therapies. For patients who received B-cell depleting therapies on continuing basis, COVID-19 vaccine should be administered approximately 4 weeks before their next scheduled. But if this spacing is not possible, CDC recommends that you do not delay the administration of the vaccine because of the immunosuppressive treatment. Lastly, when you go for your additional dose of COVID vaccine, you can simultaneously get your other age-appropriate routine vaccines. If needed, get your flu shot, get your RSV, shingles, or whatever other vaccines your provider or pharmacist thinks you are eligible for, just so you can protect yourself from the risk of illness. Remember, people who are up to date on their vaccines have a lower risk of severe illness, hospitalization, and death from vaccine preventable diseases than people who are unvaccinated. All right, that wraps up today's topic. I hope now you are motivated enough to get your updated COVID vaccine dose. I'll see you next time. Until then, stay safe and informed. Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.